Hey, hi guys. So I'm Steve Miller here at the Grow Physio Academy. And what we're going to do for anyone who's already worked in elite sport or in and around sports teams, you'll know that there's lots of constant kind of tricky challenges, different athlete cases, trying to almost organize things behind the scenes to ensure that we deliver at a really high level. So what I'm going to do is just introduce to you some of these concepts and things that I've faced in my time working within elite sport, and hopefully help you navigate some of those tricky scenarios in a bit more detail. So there's going to be 10 scenarios, and you can manage these in however you want. I'm going to present the questions. You might want to pause the video and try and answer them yourselves. And I'm just going to give you a few little pointers, not completely saturating exactly what you need to cover, but just give you a little bit of food for thought in terms of how to manage them. So you ready to rock? Let's go. So the first one, really, for anyone who's not sure, working in and around rugby is a little different to some other sports in that you have to have a front row and you have to have a specific position called a tight head prop. So they're the guys who kind of hold at the front of the scrum and allow that scrum to kind of go ahead. What I want you to imagine is you've got 3 different tight heads and you have to pick one, or else you forfeit the game. So the first scenario is really someone who's had a cervical disc herniation 6 weeks ago. They're progressing pretty well. They were in a lot of pain. They had some neural symptoms coming down their arm, and that's now all settled. They've got full sensation. They've restored full power, and they're starting to do a little bit of work in the gym and start to do a little bit of resistance training. The second athlete that you have is someone who's had 3 or 4 repeated stingers in the past 4 weeks, some of which you didn't know about. These have been transient. A stinger, if you're not sure, is some almost transient neurological sort of assault, really, where you're getting some symptoms again into that hand, and it's got some ongoing pins and needles. So a classic sign that there's still some nerve irritation or compression that's going on there. Your third athlete that you can pick from is someone who's had a grade 2 calf tear. So in the scrum, there is a lot of force going through those calves to bolster that scrum. They're about 5 to 6 weeks into what you've kind of put on an 8-week timescale for return to play. So your scenario is basically to pick which one do you want. Someone has to play, or you're going to sacrifice and forfeit that game. Obviously, the manager is mad keen to have somebody. What you need to do is clinically reason who is going to be potentially the least risk, and then just outline some of the caveats that come with that. So you've got your cervical disc herniation that's been confirmed on an MRI scan. You've got your guy with repeated stingers in the past 4 weeks, and you've got a grade 2 calf tear. So which one are you going to go with and why? So in terms of the process, really, I think first of all, what we need to do is just acknowledge that this is not ideal. This is a bit of a wicked issue, isn't it? There's no guarantees that anyone's ever not going to get injured. But with this injury history, this is tricky, isn't it? To try and navigate which one it is. And therefore, there's going to have to be a significant process that you go through to make that decision. And things that you should consider really should be things like that player welfare and safety is paramount. An understanding of those pathologies or conditions. So what is it that's going on with those? And again, you can talk about those in your interview questions and responses if you'd like. And then really what we need is that clinical reasoning process. So a bit more depth in and around what each of those conditions is, what's their risk, what's their kind of potential chance of completing that game, getting re-injured, and potentially which ones have the most long-term significant impact. And then also just an awareness, obviously, of testing markers. So if you've done any testing, obviously it's ideal to get some of that information. Now, again, the sort of caveats that you might well put into that are obviously making sure that everyone is aware of those risks. So both the athlete, the backroom staff, so you can all make a collective decision about whether they're willing to put themselves into that scenario. Decide which one you want to go with, justify it, potentially have a first, a second, and a third order. There's no guaranteed right or wrong answer, but it's just a real chance to kind of discuss what your reasoning would be. Okay, so hopefully that gives you a little flavour of kind of a really common thing that happens in rugby. Now I'm going to talk a little bit about player availability. So again, this might be someone who you have who's been training, completing components of it on the way back from injury. but the coaches are starting to apply pressure on you to bring them back earlier than you'd like for a semi-final of a domestic cup that's happening in 3 days. So they haven't completed that full return to play criteria. You haven't done the testing. You also haven't had them involved in all aspects of training yet. So can they play? And justify your decision whether that's a yes or a no. The second part of this is, let's assume that this player does go on and play, and your decision making is that they can play the first half and then they have to come off because they haven't had the exposure, they haven't had the minutes, and therefore their likelihood of re-injury is really high. What do you then do if it gets to half-time and the coach insists that they aren't coming off because they're having an absolute blinder, despite agreeing that before the game, that they could only play 45, and actually they're going to play 70, 80 minutes instead? So what do you do in that situation? So in that kind of heat of battle, you're in the medical room at half-time, probably taping something up or massaging something, and the manager bowls in and just drops this bombshell. So how are you going to manage that scenario? Again, no absolute right or wrongs, but what would an ideal look like? So would you want everybody tested before that? Would you want everybody involved in training? Of course everyone would, because your risk is then going to be less because you've already trialed that in an incremental build-up and seen how they perform. You'd ideally do testing, but actually when it comes to testing, what we also need to make sure is that if we decide, you know what, it's 3 days till the game, let's get some scores, there's a chance if we do maximal strength testing, we might actually increase fatigue, potentially irritate something, which might then lead to a higher risk of injury during that game. So again, you could talk and navigate the complexities of whether you would or wouldn't test and the risk and reward of that from there. Again, it kind of boils down to communication. So make a real song and dance of how much you would encourage a joined up collaborative decision on this. Have the athlete, the coaches, the manager, the physios, the medical input, maybe the S&Cs as well, potentially in this meeting, and just talk about the risks of lack of exposure to live sport. Obviously, the ramp up from training into that environment can be a considerable risk factor. They may well be undercooked. That sharpness might not be there. So you won't necessarily get the player that they were before they got injured, maybe 6-7 weeks ago. And what would that look like? That might help make that decision for the manager. The caveats, again, might be that limited playing time, ways to help them best prep leading into that game to give them the best chance. So it might be that actually you kind of wind things back a little bit over that 3 days so they're not going in with fatigue or kind of overload. Okay, third scenario. So this is a little bit more about the kind of psychological side and managing that sort of mental health capacity and issues that might well crop up as well. So just imagine the game's finished or training's finished and you walk into the changing room and you find one of the athletes sort of crying and visibly upset after the game. They assure you that they're absolutely fine. They don't want to talk about it. And they don't want you to basically mention anything that he isn't fit to play. So how do you then manage this situation? So I think most of us in this physiotherapy and sports therapy world are usually pretty compassionate, empathetic people. Again, how would you kind of go about managing it? Think about those communication skills, that listening part of things, trying to outline that it's a safe space to talk, all those kinds of things. Emphasize the player's safety and well-being and potentially safety net them. So it might be that you don't conduct that talk at that time, but actually you start to signpost them to individuals that if they do want to talk, then these would be the places to do it. Have they got any friends, any other staff that they could talk to, partners, etc.? And actually they can reach out to you as well later on. You also need to make sure that you maintain that relationship. So again, if they do talk to you, just instill that there's a confidentiality that comes with that. But obviously some things, depending on what you're talking about, may well need to be revealed only to the relevant sort of professionals. That might include psychologists. You might have access to a sports psychologist who's involved with the club already, or someone who you can access under the umbrella of, say, the UKSI. And then also caveats, really. So ability to maintain that relationship, come up with a clear, really concise plan that you are going to go with moving forwards. Again, different alternatives and options that are available for them. If they are over 18, again, it's on them to kind of potentially make that active move. But again, what you need to do is kind of almost raise that if you have any concerns. Okay, stage 4, so stage scenario 4. So what may well happen sometimes within the worlds of sport is that you have conflict between what the athlete's telling you on their assessment, and then they walk upstairs, go and talk to the coaches, assure them that they're fine after they've had a bit of a wobble downstairs. So in this scenario, you assess a player who's had a history of calf injuries, and she reports a really tight calf, and they're sort of suspecting there might be a small little grade tear in that calf that's hindering them. The player's told the coach that she's absolutely fine to play, but says to you that she is actually concerned about it and isn't confident about playing, given the history of previous injuries, and it feels similar to when they've torn it before. So how do you manage this scenario, really? Because you've got the athlete who's telling 2 different stories to 2 different people. You're hearing from upstairs, they're just saying that they're absolutely fine, they're going to play. Whereas downstairs in the medical room, in that nice, safe environment that's there, they're telling you something very different. And this is really common because everyone wants to play, be involved, not appear to be a bit of a flake in that scenario. So how would you sort of manage or respond to that, really? So I guess the first thing is, have you got sufficient subjective and objective data to support that decision? If you have gone through that and it's pretty stonewall, you have concerns, you can discuss that. You may well be opting to do some further assessment, an MRI scan. You might have ultrasound imaging that's potentially available there and then with the doctors or yourself. And then again, we need to discuss that diagnosis and what our medical opinion is. You might have a diagnosis, but what does that mean in reality? And this is where I think when you've worked in sport a little while, you can have those pretty honest chats, understanding the performance side of things, but also the risk versus the reward of playing. So again, they might well play the game, they might start it, they might well get injured after an hour, extend that tear, and then therefore they're out for sort of 6 to 8 weeks. Or box clever, potentially, maybe wind down, load, maybe not be involved in this, give them a bit more time to make this look a little bit better, and then obviously can carry it from there. I'd always try and set up a joint meeting with the player and the coaches just to have that kind of everyone singing off the same hymn sheet approach, so everyone's open, honest with how they're feeling. This is what's going on. Again, it might take a little bit of navigating on how to do that and what the implications are, but I think kind of prepping that with your athlete and the coaches is really important. It encourages openness and clarity. And again, you can outline the risks to everybody. No coaches or managers will want to lose their athletes or potentially injure them for sort of any time at all, really. So again, they need to know what the risks are. You'll then make a collective decision on whether they're going to go ahead or not. And sometimes that might well be against medical advice. And if it is against medical advice, then actually sometimes what you might need to do is just highlight how they're going to be impacted. So it might be that you actually, in your functional assessment, if it is a calf, can they double leg bounce? Can they do some single leg hopping? Can they actually sprint? Can they run? And actually sometimes that decision becomes very clear that they're not ready and makes it obvious to everyone. If you think that they're potentially okay, you want to appear like you're being as proactive and as helpful with your skill set as you can. We have had scenarios where we just treat, retest, and then see if you've made any difference. So if you've got a really tight calf, you could do some soft tissue work, some rolling, some heat work. You could go and boost all of their recovery, and then almost kind of just retest, see if their knee to walls got better. Are they less painful when they're doing some of those activities? And again, if it's just tightness, that's very different, isn't it, to a pathology? It's an increased risk of pathology, but actually we might be able to manage that a little bit. And this is where that hands-on sort of treatment interventions can make a big difference. Okay, coming up to the halfway point then. So scenario 5. So this can happen. So you can have player conflicts and some dressing room drama. Not everybody is going to get along within the team. There's going to be different personalities, different backgrounds, different ethnicities, different beliefs. And that can cause some potential conflict that's there. The scenario I'm going to give here is actually one that we went through as part of our Olympic and Paralympic training, and they introduced two actors to us. And the scenario that they presented was that two Olympians race against each other in the 100-meter final. One of the athletes actually trips and ends up coming last, and he was the favourite to win. So this was his last Olympics that he was ever going to do. He was kind of at an age where he was going to retire. This was his one last shot. He wasn't going to have another 4-year cycle in him. But what happens is he kind of flunks, trips over his own feet, comes last, but the other athlete in that same country ends up winning. You're the first person in to find that losing athlete alone in a room. What do you say? How do you handle the situation, knowing how upset they're going to be? And the second part to this question is, imagine that athlete's really upset and you're having that sort of intimate conversation with them, trying to navigate that. And then the other athlete who's won, obviously on cloud number 9, comes bowling in on his phone, celebrating, talking to his family about how he's kind of really overachieved. It's a dream come true. And basically, he comes along, puts his arm on the back of the other mate, and basically just goes, "Oh, don't worry about it, mate. It's all right." That athlete then reacts, is like, "What do you mean, don't worry about it? This was my one last chance to have a go at winning a gold or a medal, and I've completely cocked it up." And then it ends up becoming quite a heated conflict and altercation between those athletes who kind of start to shout at each other. So again, how would you manage that conflict? So again, there's not a right or a wrong. Do you separate them? Do you let them have it out? What sort of communication strategies are you going to use to try and diffuse that situation? Do you have any sort of history or experiences with conflict resolution? And then again, how do you kind of manage that afterwards? So how do you then, when you know you're going to go back into a shared training environment, how do you manage that? Because in a similar sort of way, we've had rugby players punch the living daylights out of each other on a pitch, but actually they quite often kind of navigate that afterwards, end up kind of shaking hands and going forward. And in the heat of battle, people say things, people react differently. So what can you do to help kind of navigate a more sort of pleasant environment going forward with that? All right, scenario 6 then. So pre-game injuries. So this is quite common. So sometimes you might well have an athlete who goes to do the warm-up with everybody else, and then someone breaks down with some sort of injury. It might be something that they've had before, something that they were kind of going into that you're aware of, or it might be completely new. But in this scenario, the key player gets injured. They come off. They're like run into the physio, can't get a hold of the physio on the walkie-talkie to get a hold of them. But the player comes in, and there's a debate over whose fault it is that they got injured. How would you respond when all of the kind of finger pointing is at you to try and make sure that you're trying to work out exactly what the issue is and who's at fault here? So were you in a position to potentially find out that, or were there any clues that someone might have well pulled up with this injury or not? And how would you manage this situation? So response-wise, how do you, first of all, handle the blame culture when it's directed at you? So the manager is pointing fingers saying you should have picked up on this. How do you handle that? Are you someone who is quite combative? Does that chimp come out inside of you and start kind of battling against them? Or do you kind of listen to that, absorb all of those kind of in the heat of the moment sort of directed attack? And then how do you go from there? I would say listening in the initial instance is a pretty good idea. So then they can kind of almost vent, get everything that they want off their chest. And then just basically make sure that you find out clarity over what is going on and what they're after. Obviously, in this scenario, it's going to be, can they play, can they not play? It might be that you can't solve this situation right now, so you're not trying to immediately sew whatever tear it is together at the time, which is obviously never going to happen. Recognize those frustrations, And then really it's about assuring that you appreciate where someone's coming from, you've understood the message, and then come up with a process as a sports science and medicine department that you can use to kind of report back to the manager. I would also be really clear on the time scale and an action plan on how you'll execute this and monitor this so it doesn't happen again with this athlete, but also with the other players. Injuries, again, are part and parcel, aren't they, really, of what's going on? And what you might have is another scenario where we have a lot of players getting injured with the same injury at the same time. We had a scenario, again, in rugby with 4 players in 3 weeks pulling up with kind of grade 1, grade 2 hamstring tears. The manager comes to you and he's clearly upset, clearly angry that this is happening. He's got way less players to pick from, but he wants you to ensure that there's no more injuries for the remainder of the season. And there's approximately 6 weeks left. He's basically running out of strikers. He's got no one to play in that position, and there are some must-win games in there. So how would you manage that scenario? Trying to get everybody through over the line to the end of that season. And the second part to the question is, you actually get to the end of the season and maybe you've had a couple of little grumbles, but you've managed to kind of almost control that hamstring epidemic. But the manager demands that there's a reduction in hamstring injuries next season. How do you manage that situation? So in this scenario, again, you want to recognise the issue, listen to their concerns and understand the implications in elite sport of missing key players. I would organise a pretty urgent meeting as a sports science and medicine department to discuss why some of these injuries have happened. And part of that will be identifying trends and changes to load management. Might be training is looked at, might be S&C sessions are looked at, might be that almost injury prevention sides of things needs to increase some monitoring work, some potential sort of changes in culture and approaches to how the athletes manage themselves as well, both physically and psychologically and physiologically. And it might be that there's a lot more recovery that needs to go in. You want to be really transparent with that. So have a real clear action plan. And then I would say almost make sure that that is tangible. So you've created an environment that you can see some of these clear changes in the plan and the process. So therefore coaches and managers can clearly observe how that looks. That might be that you're putting something in specifically into the weekly timetable on a daily basis or bi-daily basis. And how exactly you're going to execute this, why it's going to work, and how you're going to monitor the success of it. So you're going to have a short-term plan that we talked about to get to the end of the season, where we box clever, maybe looking at sort of the numbers of high-speed meters, maybe kind of screening people a little bit better short-term. We're not going to create massive strength gains in that time, which it might be, but that's more of the longer-term plan, looking at biomechanics, strength elements in different ranges, and basically building those athletes up correctly. All right, so on to scenario 8 then. So managing in-game injuries or things that have potentially happened just before. So again, people get bangs, they get knocks. We're human, so we're going to get niggles and grumbles and things like that come on. In this scenario, what I want you to do is imagine that there's what's called a captain's run. So in a captain's run, what they do, it's a bit like American football. They go through all of the plays, not at particularly super quick speed. It's really low level, but basically it's to try and get everybody mentally aware and everyone super slick and into that flow state before the game. Now, in this situation, one of your key players comes to you because they're freaking out that they've got some pain at the front of their knee. They can't sprint, which is one of their big kind of big hitting sort of weapons that they have. And actually, without that, they may not be able to kind of perform. And obviously, they may well get dropped. So they're kind of worried. They ask if they can still play. Is there anything that you can do? What would you do to kind of manage this scenario? You've got your physical side of things. You've also got the mental side that maybe they're a little bit mentally not as resilient as some of the other athletes. So again, I would prioritize the assessment and the diagnosis. Is there anything that you can do to change or influence the symptoms that they're getting that then allow them to sprint? So what can we do in that scenario? So there's soft tissue work, Is that patella a bit sticky? Is there some potential taping, K-taping options around that knee that you could do? Is the back of the knee, the popliteus or the sort of proximal gastroc or distal hamstring, is any of that tight? Is there anything else that's potentially you can do, maybe an insole, whatever it may be, in that shoe that can change the way that that knee pain reacts? There's also anti-inflammatories, painkillers, topical approaches you can do. It might be icing it, also helps. But what can you do short term that maybe causes a tangible difference in the amount of pain that they have? Be really clear with the plan. Have the caveats that are there. So ideally, you'll respond really well to this. You'll wake up tomorrow and actually feel in a much better place. Or what you might find is tomorrow that things are a little bit grumbly. So actually maybe we'll repeat this process and then see how things go from a treatment perspective. Or actually you might wake up tomorrow and go, you know what, I haven't got any chance of playing. This has got significantly worse, and therefore we'll manage that from there. The key things are obviously kind of alert the coaches and the managers as soon as you can, once you've got someone who is potentially going to miss minutes or not be involved at all. And then again, follow this up with a clear plan. I think the best sort of environments that I've kind of worked in and players who respond the best, they're the guys who they've got a real clear awareness of the expectations and a process that's going to go through. Even if that doesn't go down the most desirable route, I think just knowing what the options are and putting that on the table is really, really helpful. So communication and everything from there. All right, so next scenario. So undisclosed, or what one of our athletes or two of our athletes used to describe as secret injuries. So injuries or niggles or grumbles that they were aware of, but didn't want the medical team to know. So you're approached as coaches are concerned about an athlete's performance and want you to find out whether they have any reasons for this, i.e. an injury. So they've been observing in training, they're not performing quite as well. How do you manage this scenario? And the second part to that is when you approach them, they say their ankle and knee have been pretty sore and swollen for a few weeks, but they've actively opted not to seek any help and refuse to get any scans, as it's bound to show pathology or deficits and rule them out of Olympic selection. And there's only 8 weeks to go. How do you manage that situation? So they're actively saying, I don't want any sort of scan because anything that they find is going to potentially rule them out, or psychologically, they don't want to be aware of what those scans show. So this is actually really common. So what would you do? Well, make sure that you ask the rest of the team if they've noticed any changes or in behavior or performance, which clearly the coaches have. You might have observed things. If you haven't, maybe go and watch some videos or try and get onto the training pitch, onto the side, and see if there's anything that they're doing. Are they protecting anything if you're not aware? And then obviously kind of when you go to talk to that athlete, it's really important to outline that your aim is not to rule these individuals out. So I think a common misconception is that physios are there to try and stop you training, stop you playing. What I would say that we are is someone who's going to make an informed decision medically to help steer that decision and put things in place that help to mitigate that risk or increase that performance the best that you can. So it's definitely not about trying to rule you out. It's being really clear and trying to create a culture and an environment that actually athletes feel really safe coming to you. So you can assess them, give them a plan. Yes, you might need to share certain bits of information that with the coaches. You don't have to tell them everything. You might be kind of boxing clever with what you do. Tell them, but make sure you're kind of covering the athlete, covering yourself, and then almost kind of opening up those discussions about how you're going to manage that. So I would be looking at kind of putting in lots of little extras, lots of things that are what we would call work on. So any little bits in and around that sort of gym program, anything around training that gives them the best chance that when they step over that white line onto the competition field or mat or wherever it is, that they're actually in their most physically able condition. There's no point in just dragging a body onto there because they've trained so hard. Everything's sore, everything's flared up, everything's angry. We've got options, haven't we? We've got things like meds, and you just have to be careful that they're not overusing anti-inflammatories just to keep on going, because that's not a healthy place to be. But is there certain things that you can put in place to make sure that they are in the best possible place going into that? Other things that you might also have a little look at from that is explaining the assessing. Yeah, doesn't mean we're trying to rule things out. And again, encouraging them not to ostracize themselves. So don't just stick your head into the sand and hope that this will go away. There might well be further injury to that, and also the risk of secondary injury. So again, we are in a position that we can negotiate and justify potential changes to load or training demands based on how they present. It might be we just reduce the range of motion that they go into on a squat, for example, to make sure we just protect that meniscus or whatever it may be. But again, it builds that trust and collaboration with the MDT. All right, second one then. So high injury numbers. Again, last year were blamed for poor performance. Are you able to tell us about some risk factors for soft tissue injuries and maybe what you've introduced to help reduce these numbers in the past? If you wanted to focus in on hamstrings, as they were a particular area, what would you potentially look at? So some of this will be overlapping from what we did before, but I think acknowledging that injuries are multifactorial in nature. No two injuries necessarily happen exactly the same. We've got different athletes, different positions, different ages, different genders, and there's lots of things that can influence that. Might be lots of travel, new coaching demands, etc., etc. What you need to do, though, is make sure you're gathering the information, and particularly the facts and data on who, i.e. which athlete, their position, time in game, time during the season, etc., that these things occurred. And then the thing that you're going to work on really with the other physios, the sports therapists, the rehab specialists, maybe the S&C team and the coaches are things that you can actually physically change. So you might be able to change the way somebody moves. So what's their trunk control like, their pelvic control, might be foot mechanics, contact points, etc., etc. And then things like hamstring specific variables, like the range of motion they have, the strength they have in specific ranges, all really, really useful. And have we kind of prepped that hamstring properly? And some of the load elements that come with that is really important, isn't it? So the training volume, the high speed meters, etc., are really good preventers of injury. You could also talk a lot around that sort of screening and monitoring and making sure that we don't just do that at the beginning of a season and then forget about it till Christmas. But have an ongoing monitoring system that the athletes and the other staff can tap into. Okay, and lastly, this might be something that you've come across in different workplaces, inappropriate comments, might be kind of racist comments that you've come across. But this is the scenario. So you overhear one of the players being racially offensive about another player in your own team or even the opposite team. How would you manage that situation? And the second part to this is you agree that the player... Oh, this is from a different question. But yeah, how would you respond to that? So again, are you in a position that you can kind of call out that poor behaviour, potentially repeat that back, ask them to almost elaborate on what that is? Do you address it with them directly? If you don't feel comfortable doing that, is there some way that you can escalate that or highlight that to somebody else who may well be able to pick that up? Who picks that up and how that's then delivered and relayed back to them and addressed might be out of your hands, but it's important not to ignore this culture, isn't it? What are the implications potentially on those working relationships? So can you open up these conversations and still retain that effective working relationship? Because I think avoiding the situation isn't the right thing to do. Bringing it up is sometimes challenging with certain personalities, but actually really essential if we're going to create cultural change. But then also, is that within your sort of comfort zone to do that? Now, you might do that with somebody and they might support you through that process. But again, if you need to escalate it, you can seek that help and guidance on appropriate language and behaviours. Again, this might be a wider sort of inherent thing that's happening within the club that you might need to go through. All right, well, I hope that was useful. Again, then, this isn't completely saturated with all of the answers. You'll have to think about some of the ways that you can elaborate that and apply that to the job role that you're going for or the world that you're working in. I've been Steve Miller here at Grow Physio Academy. The Grow Physio Academy is somewhere that lots of people are growing, lots of students, new grads, and sort of people within industry trying to get better at stepping into this world. It's almost a sports placement scenario. So this is very much the sort of securing your ideal job within sport, but there's lots and lots of other information that will enhance your answers around some of the injury management, some of the assessment skills, some of the treatments and the rehab and the journeys these athletes go on to get back. So I hope you've enjoyed it. If you've got any other questions, then please do drop me a message. Be more than happy to hear from you and answer any questions and support you on your journey. So